the upper 8 ribs, right? Lateral surface of the upper 8 ribs all the way to the anterior side of the vertebral border of the scapula. This is a very powerful protractor. I said that right that time. It's a protractor. I meant the other one last time, but this time I really do mean protraction. And an upward rotator.
This is serratus anterior.
This is serratus anterior. So what you have to do is make sure the borders of the axilla are pretty much your lats and your pecs. In between that is where you're going to be on the ribs. So don't be too far back, because then you're getting into subscapularis and lats. You don't want to be up in here and all of this muscle bulk right here. That's not it. You got to be on the rib, which is pretty lateral. So don't go posterior, because now you're into subscap and lats and teres major. And don't be too anterior, because this is all pecs. We're going to come up here when we do pec minor. Stay out of there for now. Right here is where you need to be. And if they're really super ticklish, just got to grin and bear it. Because there are some people that, I mean, like, you just go touch them and they're just going to be like, I can't stand it, it's so ticklish. So just do the best you can. Okay? So that's really all you can palpate, because then it's going to dive down under the anterior surface of the scapula and attach on that vertebral border on the anterior side. So you can't get to the insertion. Okay? This is one, even though it is a scapular muscle, the resistance is given up because it's hard to resist protraction effectively at the scapula. So this one is the exception, that is acceptable to do the resistance at the arm. So this is the boxer muscle. Everybody knows this is the boxer muscle because it's the punch muscle. So you can either have them do it with their elbow straight or with their elbow bent, doesn't matter. I like elbow straight, it's just easier to explain it to your patient. And you're gonna keeping your elbow straight, you're gonna punch straight to the ceiling. Ready, go. Punch and hold. There you go. And you can feel it, it pops right out. Okay? So that would be the concentric. The eccentric would be, go ahead and punch up. Hold that as I push you down. Hold, 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 hold. Now, you'll see some people do this for the resistance. I don't like that because you have so many more joints to lose your force. I like to be as close as I can. So I'm going to do my force right here, and I'm just going to push straight down. Because then that's going to push her shoulder back into retraction, which is what I'm trying to do. As she continues to protract, I'm going to push her back into retraction. Everybody okay with that? So that's the eccentric piece for serratus. You can do it sitting. I just think I have a little bit better control. Zoom high.
You're okay.
Okay? Everybody go with serratus. Long thoracic nerve, C5, C6, C7. Clinical significance, injury to long thoracic nerve, you'll get scapular winging. Because the serratus is also the muscle that holds your scapula onto your ribs. So if you have a long thoracic nerve injury, you'll get scapular winging where your scapula sits off of the rib cage. So pretty important clinical significance there. All right, any questions on that? Pectoralis minor. Pectoralis minor is kind of the weird one because the origin to insertion piece is backwards. Because it actually originates a little bit more distally, approximately, depending on how your reference is there, so just don't be confused. I think the video said it originates ribs 2 through 4. I think your card says 3 through 5. Go with 3 through 5. The thing with pec minor, you can get to its origin, that's the harder piece, and you can get to its insertion. It's hard to match those two depending on the muscle bulk of the pec major, because the pec minor lays right on the ribs, underneath the pectoralis major. So all of this is pec major. You gotta go under that. You gotta be up in here to get pec minor, to get to its origin. Shrug your shoulder like that. There you go. It'll pop out. Relax. So you're supposed to have roller shoulder forward, and it'll pop out. But it's a very flat muscle, lays right on the ribs, and its insertion is a core curve process. So if I really don't like her, I can push my fingers together and palpate that little muscle. But you gotta go under the pecs to do that, the pec major to do that, and that's super, super uncomfortable. So for the comp, you could go origin here, insertion here, I'm good. Okay, because it's about that big, but to palpate that whole thing means you really have to go all the way under the pec major, and that's super, super, super uncomfortable. And You know, there's half the brachial plexus is under there, so don't pinch your nerves trying to palpate the whole pectoralis minor. Your patient goes, my arm's numb, that's bad. Don't do that. Okay, so just be careful what you're doing. Pectoralis minor is medial pectoral nerve, C5.
C8 and T1.
C8, T1. Oh, it's the exception. Dang it. I knew there was one. C8, T1, sorry. But medial pectoral nerve, right?
Yes.
Its job, it has lots of jobs. It is a protractor. It is a tilter. It is a downward rotator. And depression, I think was the last one. Yeah. Looks like there's 4, right? Depression, tilt, downward rotate, and protract. Basically, it's